So, as we all know, I have a lot of friends here that are doing the CNA, they're starting the CNA, they want to know what are the questions, right? So I'm going to start this series like I've been doing with the NCLEX questions. I'm going to do 3 practice questions for CNA every time I can. If I can every day, I will. But if I can't, I will just do as much as I can. So question number 1, what is the primary purpose of hand washing in the healthcare system setting? Take your time, look at the question, read the answers, and pick one. 1, to prevent the spread of infections. 2, to prevent the transmission of bodily fluids. 3, to reduce chance of spreading viruses, or to maintain cleanliness and hygiene. Answer would be number 1. It's to prevent the spread of infection. I hope you guessed that one right. Question number 2. Which of the following is a normal finding in the patient vital signs? So this question brings you to know your vital signs. What's normal, what's abnormal? Because as a tech, that's going to be your job to report abnormal vital signs. When it's normal, you just save and you keep moving. But if it's abnormal, you have to let your nurse know. And then we get to give them medicine. So A, blood pressure of 160/90, heart rate of 90, respiratory rate of 14 beats per minute, or temperature of 101.5. Okay, so what I tell my student, always tell my student, go by elimination. Okay, if you know your normal vital signs, for sure you're not gonna make a mistake, because you know that a blood pressure 160/90 is way too high. We want it around 120/70. Okay, a heart rate of 90 beats per minute is okay, right? But still a little bit on the higher side for some patients. A respiratory rate of 14 breaths per minute. What do you think? We want our respiratory rate to be between 12 and 20. So 14 is actually normal. And a temperature of 101.5. Damn, that's really high. So what's your answer? The answer would be C. Good choice. All right. Third question. Which of the following action would a CNA take to assist a patient who is at risk for falling? Most of our patients in the hospital are high risk for fall. So as a CNA, you have to know what are your high fall risk patients and what do you do. Okay, A, locking the bed wheels. B, putting up all side rails. Do you get to do that? C, keeping the environment clean and free for clutter. And D, providing the patient with a blanket to help them rest. What does the blanket, then again by elimination, what does the blanket has to do with preventing risk for fall, right? So take your time. So answer would be C, keeping the environment free from clutter, because if things are all over the